Okay, our next speaker is Matthias Ehrhardt from here. And Matthias is talking about combined image reconstruction for combined PET MR imaging.
Thank you very much. Thank you very much for the opportunity to speak here. So this is work I did back at UCL in London, and it's also a collaboration with Biomedical from Finland. And we want to talk about what can we do if we do combined PET MR imaging. So first of all, let's talk a bit about PET and MRI. So like this is one example of a PET scanner, and as many of these looks like a donut-shaped scanner. And before we can put the patient into that scanner, we need to inject a radioactive tracer into the patient. Then we put the patient into the scanner, and then what it does, like the tracer is a positron emitting tracer. So the positrons annihilate with electrons. Two gamma rays are being sent out and collected by the scanner. And we now try to reconstruct the distribution of the tracer from millions of these measurements. In the case of MRI, again, we have a donut-shaped scanner, but now we do not inject a radioactive tracer, but we put the patient straight into the scanner. And these are the hydrogen protons in the tissue of the patient. And when there is no magnetic field, I mean, they sort of like are randomly aligned. And now with the large magnetic field of an MRI scanner, these get aligned with magnetic field, and which creates a certain signal that we can collect in coils around the patient. And the nice thing, so like why I got interested into this, so now we are able to do combined PET and MR imaging, so that we can combine these two imaging modalities into one scanner and acquire PET and MR data at the same time. And if you do this and reconstruct from this, and on the left-hand side you can see an FDG PET image, and in the central column you can see a structural MRI image. And what usually is done, so that these modalities are then being combined on the image level by, for instance, like overlaying them or doing statistics on them combined. But like now in this project, we would like to go one step further and combine these modalities already in the image reconstruction. So the talk is divided in two parts. In part one, we want to utilize the high-resolution MR information for PET reconstruction. So this is what like Simon referred yesterday as one-sided reconstruction. And in part two, we want to do fully joined reconstruction, where we reconstruct PET and MR in the same process. So let's start with part one. So this scheme shows sort of like what we want to do. So like we have acquired our PET data. We want to reconstruct from this, and there are like many ways how you can do this. I mean, here I now showed you two examples. One thing that is sort of like kind of popular is like maximum likelihood expectation maximization, or in short MLEM. Or you can also do like total variation regularized reconstruction. Two different algorithms lead to a bit different result. And now what we want to do, now we want to use the high resolution MR information to enhance on these results. And I mean, there are many different ways how we can do this, and the strategy that we want to do in this talk is that we formulate the image reconstruction problem as a minimization problem, where we have a term that is a data fit, now described L, so we want to be matching our data, but in addition we want that our solution has a certain regularity, now here encoded with R. And one example of a regularization function or prior that is very popular is the total variation prior, proposed more than 25 years ago, which is like over here, and this is very popular because it leads to edge-preserved reconstruction. And so there are different formulations how you can sort of like phrase the total variation prior, and while in its original formulation in the central row you can see that this is like now non-differentiable, they have been proposed like smooth variants such that we can do a gradient-based optimization when we use this as a prior. So in order to incorporate high-resolution MR information, we chose the strategy to incorporate the MR image, now denoted with V here, into the prior. And we want that this prior fulfills certain criteria. On the one hand, this needs to be convex in the PET image U, such that the minimization is still robust, stable, and reasonably efficient. On the other hand, also we want that the prior does not depend on a segmented MR, but on the real MR, because otherwise we might have errors in the segmentation that then sort of like get introduced into our PET image. So we want to skip this step. And the third criterion on this like depends on the taste. So like what we want to have is that in a region where the MR is flat, it doesn't provide any information. There we want that it reduces to a total variation prior, such that we are still doing edge-preserved denoising. And there have been plenty of priors and methods introduced to incorporate high-resolution information either from MRI or from CT into the PET reconstruction. And here's a short selection from them. And as you can see, sort of like pretty much all these methods, they fail either of these three strategies. And what they often commonly fail is like the convexity, when they are based on some information theoretic priors. And some of them of the earlier works, especially for instance here by Lee and Yan in the early 90s, they are based on a discrete approach where really like sort of every pixel interaction is being penalized and such that therefore it like heavily relies on a segmentation. There's been also done other work in a similar setting, but not in PET MRI, but like in EIT, electron impedance tomography, combined with CT, where they use essentially the same framework, but like for different modalities. And the prior that we're gonna introduce is like motivated by this one, but we extend it in a way such that it reduces to total variation in the degenerate case that there is no a priori information locally. So to explain you how this prior works, I see two images, one for PET and one for MR. And first of all, I mean, as the images, although like from human point of view, these look very similar. So if you have something that directly works on intensities, then these images actually look kind of very different. So therefore, we need to lift ourselves and go away from the intensities and work on level sets. The problem is now that the level sets or contour lines of these two images, they are pretty much the same, so I can't explain you how the prior works. So therefore, let's start with a very simple image where they have very different level sets. So if we now draw the spatial gradient onto these images, then we know that the spatial gradient is orthogonal to the level sets, which allows us now to measure how structurally similar they are. And we know that the spatial gradients, they fulfill this equation, so like now we can measure how structurally similar they are. Like based on this, we define this this function, yeah, where we just shift over everything to one side, and then this function, so like we can measure again. We can measure how structurally similar they are, but then this function has one problem. That it's not defined when the MR image is flat, so when the gradient of V is 0. So therefore, we regularize this function such that it's also well defined in the degenerate case where the MR image is flat. And this function has two nice properties. So like first of all, it is sort of like in a sense sandwiched between 0 and the magnitude of the gradient. So it's in a sense like it's between like 0 and the total variation. And on the other hand, it is 0 if and only if the two images that we want to work on are structure similar in the sense that their gradients are parallel or collinear. So based on this local structure similarity measure, we can define a global structure similarity measure by just integrating over the whole image domain. And for optimization purposes, we also introduce the same smoothing with a beta here as we did before in the case of total variation. And now it turns out that this prior fulfills all the three criterions. Like first of all, it is convex in U. It might not be easy to see, but we can prove this. Second of all, it depends directly on the MR image and not on a segmented MR. And third of all, it reduces to total variation when the MR is flat, meaning that this guy becomes 0 and we end up with smooth total variation. So now some numerical results where we applied this to a setting of PET MR. And we compare this to 4 other priors that have been introduced for the same kind of problem in the literature. So one thing is what people call joint total variation. So this now depends on the magnitude of the MR gradient and not the direction anymore directly. And what it does, like when the magnitude of the MR image is large, then we do not penalize the PET image so much anymore. So like in a certain sense, it sort of like incorporates the locality information from MR into PET. The second prior we use is what became known as Bausch's priors. Like this now depends not on a continuous formulation of the PET image, but like on a Markov random field approach, and where certain interactions are weighted more than other interactions, and these things are exactly weighted in a way such that sort of like if the pixels are similar in the MR image, then this weight becomes smaller or even zero, such that we allow a jump along these edges. The third prior that we compared to has been proposed by Kazantsev 2 years ago, and this is, if you know about Brakmann distance, this is related to a Brakmann distance. But now an interesting feature here, and we will also see this in the numerics later, that now the sign of the gradient in MR actually plays a role. So like this is not independent of the sign anymore. And the fourth thing is the one that has been proposed for EIT with CT, which is like basically the same as our prior, but it doesn't reduce to total variation in the degenerate case, but it reduces to something quadratic when this term vanishes. So as a summary, sort of like we have like 4 properties I think that are like also important, that we reduce to total variation, and some of the priors do this, some others don't. Then also that we couple these images by the location of the edges, and then it turns out that actually all 5 methods do this, and then some of them use direction, some others don't, and some do not allow negative edge correlation. But now let's look at some results. So these are the 3 data sets we use to test this kind of approach. So there's a software phantom, a hardware phantom, and some clinical data. So for the software phantom, as we know the ground truth, we can sort of like measure how close the result is compared to the ground truth. And it turns out, so like in these three plots, so like as small as possible is good, and in this one as large as possible is good. And it turns out that the 2 priors that are based on this parallelicities idea always significantly outperform the other priors in the regions that the PET and MR have in common, like in this case, gray matter or the whole phantom. And in case when we talk about lesions that are not present in MR but they're present in PET, then all priors perform roughly the same. But we can see that the 2 priors that sort of like do not reduce to total variation, they sort of like introduce more error into the reconstruction than the total variation priors do. And now let's compare this proposed prior to some sort of like independent reconstructions. So we only reconstruct PET with either MLEM or with total variation, and then we either show it normally or overlaid on the MR, and we can see, of course, exactly what we hope for, that by using the high resolution MR information, we get like better defined features in PET. So if we compare the 5 priors, then sort of like now they all use the high resolution MR information. And we can see here, so like similar to what we have seen before in the error plots, that the 2 methods that use parallel sets to couple the gradients, they perform sort of like a higher level of detail. And one thing that's maybe like worth to be noted, this prior where actually the sign of the MR plays a role, this is not able to reconstruct the gray to Y meter boundary, as in this example, the MR and PET are negatively correlated. Yeah, so like in MR, so like here we have a step up, while in PET we have a step down. This prior doesn't allow it, so we get rubbish here. Maybe let's skip this one. Then furthermore, I mean, as we know the ground truth, we can look at also that bias versus standard deviation, and here we can see basically exactly the same thing, so that the 2 parallel sets based methods, they significantly outperform all the other methods, with again the total variation one being a little bit better. And also like in the lesions, so like all these curves, they are all very close together. But also here, for instance, as in the right hot lesion, we can see that the methods that reduce to a quadratic prior, they have a larger bias in the hot lesion. The same can be seen if you look at bias and standard deviation as an image. I mean, let's don't go into details. Okay, this has a very low contrast. Anyhow, it doesn't matter too much. So, but like one thing that I would like to stress here is like these 2 are now the parallelism-based method, and these 2 are the independent methods. That by incorporating the high resolution MR information, we can actually also, as we see here, reduce the bias in the image. Yeah, so like by introducing this a priori information, we reduce the bias. So the same can be seen from a hardware phantom, where sort of like now the PET and NMR, they show pretty much the same structures, besides like there's one structure sort of missing in MR that is present in PET. And we can see that using parallel sets gives you nicely defined structures. And in addition, sort of like if you reduce to a total variation based prior, then the structure that's missing in MR but present in PET is then nicely reconstructed. Sort of like pretty much the same conclusion also can be drawn from the clinical data, where again sort of like using the high resolution MR information helps you to enhance the PET reconstruction. And these are is a comparison of the 5 priors. Let's maybe skip the one. So as the conclusions of part 1 of the talk, we have seen that now there's like a new prior to incorporate anatomical structural information, and this is convex, doesn't need a segmentation, reduces to total variation. It is based on directions, not only magnitude, so we use more information from the MR. It can handle images of arbitrary intensity, so the gradients can be positive or negative, correlated, whatever they want. It is better in many quality measures, and among them in bias versus standard deviation trade-off. And also it reduces the bias of the total variation prior that is in a sense sort of like related to Bregman iterations. And so for the rest of the talk, let's maybe talk about joint reconstruction of the two. And so why this was the story before, so like we had our PET data and then we want to use the MR to enhance the PET reconstruction. But actually the MR scanner doesn't really acquire this image directly, but it requires data from which we can reconstruct the MR. But like for instance, if you do undersampling in MR or there's some motion that happened or whatever, then sort of like we have a problem of reconstructing the MR. So directly using this information to reconstruct the PET is probably not a good idea. And instead of doing this, we look at sort of like how to combine all of this to reconstruct the PET image from the PET data, the MR image from the MR data, by having the joint a priori information that they both come from the same anatomy. And let's go over this one. So how do we do this? Sort of like we start from the joint log posterior, and based on a very simple graphical model that sort of like that explains our intuitive beliefs on how this joint framework works. That sort of that there are basically independent, but sort of like they are related by a common prior, so that this splits essentially the joint posterior into 3 parts. Where if we now take the negative logarithm, we end up with minimizing a cost functional that has the PET data term, the MR data term, and a common prior. So and now let's have a look how we can model this joint a priori information. And so now we go back to the slide that I've shown you before, but instead of doing sort of like forming a prior that is sort of like reasonably well defined for the PET image, we now define a prior that is sort of like nicely defined for both of them. And so this prior has sort of the same properties as before. So like on the one hand, it is non-negative, and second of all, it is 0 if and only if these 2 images are structurally similar in the same sense as before. And we now can again make it a global structure similarity measure by integrating over the whole domain. And one nice property that this prior has is that if you take 2 images and they are structurally similar, and now you assign different colors or different intensities to one of these images, then it holds that if these 2 images were structurally similar before, then even after a change of colors, they're still structurally similar. And like if you do a clever choice of like changing colors, then you even get an if and only if there. So like this really, in a sense, like does exactly what like one intuitively would have in mind when we talk about what's the structure of an image. But like one problem that this now has is in the degenerate case, when one of the 2 images is flat, so the gradient is more or less 0, then the whole prior has its global minimum state. So it's not really desirable. So instead, therefore, we propose to sort of smooth all of these norms. And when you do the following, then the prior has a property that if one of the 2 images is small, with respect to this parameter beta that we introduced, then we reduce to something like a scaled smooth total variation. So and obviously, like based on exactly the same arguments that I used before, one can generalize the same idea and introduce monetarily increasing functions phi and psi, and come up with a whole family of parallel sets prior that have all the same properties. And now in the numerics, we will compare 2 special cases of this. It's one what we call linear parallel sets, when both of these functions are the identity, so that both sort of disappear these functions. And the other one is where the inner function is quadratic and the outer function is the square root. And both of them have like the property that we reduce to something total variation like in the degenerate case. And one slide that's a bit similar to what Simon has showed you yesterday. So if we have these kind of priors, and now we want to look at what are minimizing sequences that are sort of like more and more likely with respect to this prior. So if you do use total variation as this, then you get two independent sequences. So the images get simpler and simpler until they sort of like disappear in structure. If you use quadratic parallel sets, the images also disappear, but on the way they become structurally similar. And if you use linear parallel sets, then actually you converge to a non-trivial local minima that like has the same structure. So then we can also like explain exactly what we've seen before in terms of mathematics. So when we take this prior and compute the derivative with respect to one of the images, it turns out that it has a form of an anisotropic diffusion. So like K is now a matrix. And in addition, we can sort of like analyze what this diffusivity K does. So like if you now look at the gauge coordinates of the other image, which are given in terms of the normal and the tangent vector at each location, then it turns out that these gauge coordinates are actually the principal directions of this diffusivity. So these diagonalize the diffusion tangent there. So now I would like to show you some numerical results at the end. So now we have two images that sort of like they are structurally in some sense like similar. They have lots of structures that they have in common, very different intensities. If, all of them have like a few structures that are present in one image but not in the other one. And if we now reconstruct from this, it turns out that total variation for PET is like not able to recover the image well. So I mean you have a loss of resolution. If you have the full MR data, you reconstruct the MR side very well. And if you do a joint reconstruction, one thing that is like very nice and promising is that you do not degrade the MR result, but in addition you enhance the PET. So, but what we are really interested in, so like what are the cases when the MR data is not enough to reconstruct a good image anymore? So because I mean, even if you have like this kind of undersampling pattern, you still get a good MR. But if you go to even more undersampling, then at some point you're not able to reconstruct a good MR anymore. But actually it turns out by reconstructing these two images jointly, by either quadratic or linear parallel sets, we can reduce the number of undersampling artifacts in MR, in addition to sort of like getting the high resolution information from MR into PET. And this is not only true for these radial sampling schemes, but also true for the spiral sampling scheme. And if we now look at some quantitative results, then we can see with PET on the left and MR on the right that if you do joint reconstruction either with quadratic in red or the linear parallel prior in green, this consistently outperforms the separate reconstruction for PET, independent of the undersampling scheme. For the MR, so like this is now a bit different, because if we do full sampling in MR, then we get really nice reconstructions for all of the methods. But for different undersampling schemes and different amount of undersampling, so while some of these techniques, especially the independent ones, they perform really, really bad, especially using linear parallel sets gives you a much better reconstruction. So by this I would like to conclude the talk. So like now in part 1 we have seen that there is a new prior based on this parallel sets technique that can incorporate high resolution information from MR into PET. And in part 2 I've showed you how to do joint reconstruction for PET and MR. And hopefully you have seen from numerical examples that this parallel sets idea successfully can encode joint structure and can successfully enhance joint structure. Also from the mathematical analysis we have seen that like by minimizing this parallel sets prior, we actually result in a structurally coupled anisotropic diffusion. That's also not very common for many of these kind of priors. And thirdly, sort of like the numerical results have shown by combining these two inverse problems as one joint problem, actually both of the inverse problems can benefit from this. Thank you very much.
Thank you very much, Matthias. I think this was a nice sequence of talks, because we have the multimodal image analysis and now we have the multimodal image reconstruction. Yes, please.
The fundamental problem in PET-MR is attenuation correction. I didn't hear any mention of that.
That's true. That's true. So if you want to do attenuation correction that sort of like is probably will be based on the MR, then sort of like if you want to reconstruct the MR using PET, but want to reconstruct the PET using the attenuation from MR, obviously this results in a problem. I mean, one needs to find a way around it. Maybe like in a cyclic process that you first try to reconstruct without attenuation correction. Based on this, you maybe make an estimate for the attenuation, include this and enhance. But obviously, this is an open question. That's true. Good point.
The method applicable to more than two imaging methods or two images at the same time?
So although it is designed for two images, so we successfully applied this, for instance, to RGB color imaging, where you use this prior in a pairwise approach. Obviously, if you increase the number of channels, let's say you have like 10, 20 channels, doing a pairwise approach then leads to lots of terms. So then this maybe does not become the method of choice anymore. But like for a few channels, it's certainly no problem.
Thousands, though.
Well, 1,000 channels, then this is a bit tricky if you do the pairwise. So like probably you want to use something different. Although I mean, for many hyperspectral techniques, people have found that actually it's often not, although you might have 1,000 channels, it's often not so good to actually incorporate all the information all at once, but then rather than know which channels when to combine, so like to have like certain subsets of the channels, it's often better than using all at once. So and then in case, although you have 1,000 channels, this method still might be applicable.
Ron?
Just what are the sizes of the reconstruction volumes? Are you starting to run into computational issues in terms of practically implementing it on a desktop computer?
So, I mean, everything I've shown you today was in 2D, and obviously sort of like for clinical practice you want to go 3D. The algorithm side was not so far focus of my work, but actually at the moment currently with Carola we're looking into this. So probably on the algorithm side you want to do something smarter than what I did here in this project if you want to apply this to 3D volumes. But in principle I don't see that this is any problem. I mean, you need smarter algorithms, but I think this can very well be done.
Let's thank Matthias again for an interesting talk.